White Plains Hospital Orthopedic and Spine Surgery is known throughout the region for excellence and innovation in joint replacement. A multidisciplinary team of board-certified orthopedic surgeons, physician assistants, nurse practitioners, nurses, and physical therapists will work together to care for you during your hospital stay. In this presentation, the following items will be discussed: what to know before your surgery, what to expect the day of surgery, your stay at White Plains Hospital, post-surgical care at the hospital, and getting ready for recovery at home. What to know before surgery. Pre-admission and surgical testing. Once you have decided to proceed with surgery, you will need to be seen by a perioperative medicine provider at the Surgical Navigation Center for pre-operative clearance and optimization. Blood work is required within 4 to 6 weeks of surgery. Speak with your provider to see if any medications should be stopped before surgery, such as blood thinners, NSAIDs, or aspirin. At White Plains Hospital, we utilize an enhanced recovery after surgery protocol. The Enhanced Recovery After Surgery program includes healthy habits and hand washing, expectations for pain management, eating well, and staying active prior to surgery, breathing exercises, and skincare. Preparing for your surgery. Basic instructions for preparing for surgery include stopping smoking, maintaining an exercise regimen, and practicing good oral and hand hygiene. Additional guidelines for optimal outcomes include your diet, breathing exercises, showering and bathing, and preparing your home. The Orthopedic Joint Coordinator is available to provide support and education to patients and families before and after surgery. Before surgery, patients will meet with the coordinator to discuss education, what to expect before, during, and after surgery, and aftercare needs such as medical equipment and visiting nurse services. Your diet. Leading up to surgery, patients should follow meal plan instructions. Days and weeks before surgery. Eat protein-rich foods such as chicken, fish, dairy, as well as fruits and vegetables packed with vitamin C. Include foods with zinc such as beef, oysters, nuts, or seeds. Day before surgery. Drink plenty of fluids. 8 hours prior to surgery. Stop eating solid foods 8 hours prior to surgery time. You may only drink clear liquids until 2 hours prior to surgery. Breathing exercises. Exercise your lungs before you arrive at the hospital. Before you go to sleep and when you wake up, perform 10 sets. Sit in a chair or on the edge of your bed with your back straight. Inhale slowly and deeply. Hold the air in for 3 to 5 seconds, and then slowly let the air out. Showering and bathing. Do not shave or use depilatories on your leg for 1 week prior to surgery. 48 hours prior to surgery, do not shave any part of your body except face. Shower the evening before and morning of surgery using the antiseptic soap provided to you. If you have a skin condition, please check with your primary care doctor or dermatologist if it's safe to use the provided antiseptic soap. We recommend to prepare your home prior to your surgery to create a safe environment for your post-op recovery. Do not plan for home renovations or construction during your surgery and recovery period. Clear paths. Don't have rugs or other potential fall hazards in the way. Stock up on easy-to-prepare foods. Use a commode, raised toilet seat, or a tub bench. Not all equipment is covered by all insurance. The care management team is available before and during your stay to assist patients and families. The team's goal is to ensure a smooth transition home from the hospital for patients. The team assists with pre-ordering medical equipment as applicable and pre-arranging visiting nurse services. After surgery, patients are also contacted by White Plains Hospital Cares to ensure a safe transition to home. What to expect on the day of surgery. Arrive 2 hours prior to your surgery at the admitting department. You will go through a process of site verification. Staff will perform a finger stick if you are a patient with diabetes, 45 years or older, or have a body mass index greater than 30. What to bring to the hospital. Bring a list of your medications. Also bring undershorts or underpants, and if desired, loose-fitting clothes, robe, or pajamas. Eyeglasses, hearing aids, or dentures if you use them. Loose-fitting clothes and shoes for discharge. If bringing a cell phone, please bring your own charger, and money if needed for transportation upon discharge. Remember to leave any valuable items not necessary for your stay at home. Anesthesia. You will meet with your anesthesiologist to discuss the various options for anesthesia. These may include spinal, general, local, or a peripheral nerve block. If you need further information, you may contact North American Partners in Anesthesia at 914-428-5454. Your surgery. Your surgeon will meet you in the pre-op area and review your surgery and any concerns you may have. Your actual surgery will take approximately 1.5 to 2.5 hours. Following surgery, your surgeon will speak with your identified personal contact. You will be brought to the post-anesthesia recovery room, otherwise known as the PACU. Your stay at the hospital. If pre-op plan is to discharge home same day of surgery, you will discharge from the recovery area after working with physical therapy. If overnight stay is required for your surgery, you will be taken to our orthopedic unit 4I. Most admitted patients will discharge home the day after surgery. Your comprehensive care team. During your stay, your surgeon will work closely with a team of magnet nurses and specialized orthopedic advanced practice providers, otherwise known as PAs or NPs, to address patient needs. Pain control and medications. A multimodal method of pain control is developed to control your pain. We use a pain assessment scale to monitor your pain level. Antibiotics will be administered for the first 24 hours to prevent infection. Blood thinners will be administered according to your surgeon's recommendation to prevent blood clots. Nausea and healthy bowel regimens will also be discussed with nursing. Holistic care program. To improve quality of life, manage pain, and other symptoms, patients can take advantage of the Holistic Services Program. Services provided include Reiki, therapeutic touch, healing touch, guided imagery, meditation, relaxation techniques, gentle massage, touch, reflexology, or aromatherapy. Fall prevention. Your safety is important to us. Please don't get out of bed without assistance. A staff member will always accompany you when getting out of bed. Infection prevention. All employees are required to wash in and wash out during each patient encounter. In addition, the following measures are taken into consideration to ensure safety risks are minimized. Please do not touch your incision. Use hand sanitizer frequently. Sheets are changed daily and more frequently if necessary. Patients with diabetes and high-risk patients will receive proper blood glucose control. Blood clot prevention. Blood thinners will be administered according to your surgeon's recommendation. Sequential compression devices are also applied while patients are in bed. Post-surgical care. Physical therapy. Goals of physical therapy. Prevent tightness and stiffness, improve patient awareness, strengthen muscles around the joint, improve functional mobility, get you up and moving as soon as possible to promote a successful recovery. Each session is 15 to 30 minutes and typically start on the day of surgery. If you have stairs at home, a physical therapist will practice stairs prior to your discharge. Physical therapy begins on the same day following surgery. Patients receive physical therapy every day while in the hospital following surgery. The session may include bedside exercises, bed mobility and transfers, standing, ambulating using an assistive device, activities of daily living, car transfer practice, and stair training. Your therapy team will also review a home exercise program and techniques for home activities. Getting ready for recovery at home. Patients can be discharged as early as the same day after surgery, once cleared by physical therapy. Identify a pharmacy where your prescriptions will be sent and notify the nursing staff. Make sure you plan ahead for transportation on the day of discharge. Identify a family member or friend who can bring you home. Prior to discharge, the care management team will meet you to discuss a personalized discharge plan. Your discharge plan is based on post-operative medical status, your mobility, home environment or support, and insurance. While you are recovering at home, please continue your pain management regimen. This may include over-the-counter medications with the goal of minimizing and eventually eliminating use of any stronger prescription pain medication as soon as medically appropriate. Narcotic pain medications can be habit-forming. They should be used with caution and only as directed when pain is severe. Constipation is a common side effect of narcotic pain medications, so it will be advised to take an over-the-counter stool softener and possibly a laxative. It is important to ice frequently, approximately 4 to 6 times per day for 20-minute intervals. This helps to reduce swelling, which will limit pain. Use a thin towel between the ice and your skin to protect your skin. Swelling may last several weeks after surgery. Over-the-counter compression stockings are helpful to reduce swelling. You will be provided with wound care instructions at discharge. Always clean your hands with soap and water or an alcohol-based hand rub before and after caring for your surgical incisions. Showering, either while standing or sitting in a shower chair, should take place according to the instructions you receive at discharge. No pools, baths, or soaking of the surgical incision until the surgical incision has healed unless specifically instructed to do so by a provider. Initially, you will be ambulating with a walker and then transitioning to a cane. Eventually, you will regain your strength and stability and will no longer require assistive devices. Remember, safety comes first. Do not spend the whole day in bed. Be sure to get up and walk every hour during the daytime to prevent blood clot formation. You should gradually increase your activity each day after surgery. Blood thinners will be administered according to your surgeon's recommendation for up to 6 weeks to prevent the development of blood clots. Avoid driving for 4 to 6 weeks until cleared by your surgeon. Contact your surgeon or physician if you experience fever, redness, or swelling at the surgical site, drainage from the incision, or calf pain. Signs and symptoms to look out for: fever, chest pain and/or shortness of breath. Seek immediate medical attention. Redness, swelling, warmth, and/or bleeding through the dressing site, numbness and/or tingling, increased pain, inability to walk or move your joints, incision coming apart. It is important that you take all your medications as prescribed by your doctor and attend any follow-up appointments. It is important to follow up with your surgeon approximately 1 to 4 weeks from surgery or as directed by your surgeon. Contact your surgeon's office if you have any questions or concerns while recovering at home. Thank you for choosing White Plains Hospital.